Are you struggling with pain in the back of your heel? It may be Achilles tendinopathy or Achilles tendonitis. What I want to share with you today are some tips to help you overcome this so you can get over your pain and get back to running and loving it again. Hi there, I'm Dr. Lynne Virant, owner and physical therapist at the Movement Clinic in Pensacola, Florida. And today I'm going to talk to you about Achilles tendon. First tip is if you're already struggling with pain, you may have to modify your activity. Typically, we want your pain levels to stay below 3 out of 10. So if you're having any pain above that, the first thing you might want to do is stop running altogether. If you're having pain even with walking, it may be ready for you to address a couple other things. You want to walk around in a shoe that maybe has a little bit of a higher drop. So right now I'm wearing a shoe that has an 8mm drop, and I typically wear a shoe that has a 5mm drop. And if you tend to walk around barefoot at home, you might want to put on a shoe and maybe include a heel lift. If you aren't having that much pain and you're able to run, what we want to do is not increase those pain levels. So you want to modify your activity either by decreasing the amount of time that you're running, decreasing the speed at which you're running, go from maybe hilly routes to a flatter route, and maybe even avoiding terrain that is a little bit uneven for something that's flatter or a little bit more firm. While you're taking some time off from your activity, rather than jumping right into strength training, this is actually a really good time to look at key areas that may be why you're having pain in the Achilles tendon in the first place. One is your foot. Other option might be that your hip is not moving well. So if you add strength training and your feet or your hips aren't moving well, then you might actually negate any strength training that you're trying to incorporate. So a couple key movements that can give you an idea if your ankle is not the only issue is when you try to bend your ankle forward, when you try to bend your ankle back or even your big toe, and then actually when you try to open up that hip. If any of those areas are affected, that could be why your Achilles tendon is having an issue, and you want to get those addressed at this point in time. Now that you've addressed A, what kind of Achilles tendon issue you may be having, 2, making sure you're looking at your feet and your ankles as well as your hips, hopefully by this time you're ready for some strengthening. We want to do it progressively, meaning making sure that we add the right amount of activity so that you get that strength, but not too much that you get re-injured. The best way to do that is starting with activities that you do in 2 leg. So your classic calf strength, where you're coming up onto your toes and lowering down. And then as you progress that, you can progress that going from 2 legs up and then 1 leg down to just 1 leg at a time, all right? So the other way to progress that is by focusing on just the area where you're struggling. So if you lift up and that's where it hurts, that's as far as you go. And then you lower down. That's called isometrics. So you're creating tension at the area where you're limited. And then from there, you progress again to that small range of motion, to a full range of motion, and then all the way down and be on a step where you're actually lowering down past the level ground. In addition to progressing from 2-legged to 1-legged, from smaller range of motion to greater range of motion, we can also progress the pace of the movement or the speed of the movement. So first you're going to go up slow and down slow, and then eventually you cadence that's 1 per second. You're going to go up, down, and then if you do it to a cadence that you run to, you might do it to a cadence that you run to as well. Man, that's fast. All right. This is really important because when you land, your body takes about 2.5 times your body weight through the whole leg, and then when you push off, your calf muscles generate over 6.5 times your body weight. So not only do you want to have that strength when you land, but you need that strength in those muscles when you go to push off. As you develop full range of motion in an ankle joint, increase the speed, and been able to go to 1 leg, we want to incorporate the full body. So for example, starting with your calf stretch motion, bend the ankle forward and back, and then lift that heel up. And then from there, we're going to progress it to a squatting motion. That's similar to what you look like when you're at the mid stance of your run, and then progressing it to the push-off motion. So lifting up that opposite leg, all right? So all of those are just a way to break down the running motion or walking motion to address moving the ankle, the hip, and the knee through your running and walking motion. We want to have activities and exercises that address all of those areas. I hope this helps you overcome your issue with Achilles tendonitis. Please continue to subscribe for more information on how you can run better and stronger for life. And if you're ready to work together, check out my website at getmovingpt.com.